Hi, this is Dr. Sell. It's hurricane morning, and I decided to talk about the hurricane and Bagels telephone therapy. Why I thought about telephone therapy on the way up here is that many people who can't avail themselves of therapy by the usual methods or can't find a therapist in their area can talk to therapists on the telephone. And some people can't because they don't like the telephone. And that's understandable. Although I like to investigate what it is about the telephone. They can't see me face to face. Well, what is it about not being able to see me? Some people say, well, I'd like to look at your reactions, and I'd say, well, how about telling me what you're thinking about my reactions rather than think about it? Because many people will not say that, but they might look at me directly and wonder if I'm judging them or etc., etc. So I use the couch a lot with people, and because it's easier to free associate, that's where our unconscious stuff and irrationality resides. So if you eliminate distractions like looking at somebody, you're more likely to get in touch with your deeper unconscious self that really controls much of our life. So that's about a little bit about the couch and a little bit about telephone therapy. My first person who was referred to me many years ago for telephone therapy was because, as a matter of fact, Dr. Lucas, he was looking for somebody that would do telephone therapy for somebody who was living up in the Northeast and could not find an adequate therapist. There was a colleague of his that asked him if he knew of anybody. So modern analysts have been doing telephone therapy for years and years and years. I know 20 years before anyone ever thought about it, because modern analysts do things that other people don't do because they're just a little bit unconventional that way. Sometimes that could get in their way, and sometimes it's in a benefit. So anyway, we've been doing that for a long time. I know classical analysts, even to this day, when they think about referring somebody, for instance, patient's got to leave their state, and due to whatever reasons, I always like to investigate those reasons to make sure it's not because they're trying to get far away from me. Sometimes I might say, well, why don't you even go a little further? Try Hawaii instead of California, and then you could even get further away from me because it's hard to talk about things that are on one's mind. It's very difficult, and I appreciate that. It is very difficult. Every analyst who's been in analysis or therapy knows that. But I like to investigate things. So with this first person that was referred to me, it was about 1.5 years. This is sounds like a miracle cure, and it really wasn't. There aren't any miracles, but he discussed with me his life situation, and through telephone therapy, we were able to. I was able to help him talk to me about his feelings about me, which helped him talk to his father about things that he had not been able to talk to his father about most of his lifetime. And he resolved some of his conflicts about his father, began to have a talking relationship with him, and also moved in with his girlfriend, which he had not been able to do for some time. And I think he also, as far as I remember, stopped drinking. So that's very fast action on the part of therapy. I think I was lucky enough to have the right combination, and who knows, maybe that person succumbed to, it's early in the morning, it's 6:30, that's my excuse for fumbling around with my words, but so maybe he succumbed afterwards to falling back into old patterns. That's why its follow-up is very important in therapy. You have a good beginning, but you need to follow up. So he has not been in touch with me, but I hope everything is going well with him. So this morning, what made me think about telephone therapy was it's the hurricane, and I'm not so sure how, I don't know how bad it's going to be. I'm at work at 6:30 because I don't have to come that far. I don't have to come by train, and so it's easy for me. But I was thinking about patients and whether they're going to call in or not, and some I haven't talked to about my policy that there's a 24-hour cancellation policy. No matter whether it's the sky is falling down around their head, there's always the phone. So as long as they give me 24 hours, I don't charge. Because there's nobody to bill for hurricanes, so, and I have to make a living too. But I don't hold people to that unless I explain my policy to them in advance, and I don't usually like to talk about policies in advance because people experience it as a they're going to be punished if if they don't adhere to a policy, and we have too much punishment in ourselves in terms of criticism. So I don't like to set that up in therapy that way. For other therapists who are listening, I always like to let my policy evolve to see who somebody is and how they're going to be in therapy. So if they come late frequently, I won't mention it, and I don't want to make them feel criticized or uncomfortable. I don't mention it, but eventually I will set up my policy and by the way, I don't know if I talked about my policy about missing sessions. Coming late is fine. I don't like to make people uncomfortable either about coming late. Let them evolve and let them tell me who they are, and then we'll investigate it later. But the hurricane made me think about telephone therapy. Telephone therapy is I work with people from the outside of the United States. I work for people in New York with telephone therapy. I don't do it too much in other states, except for a couple of other states in the United States, and I work with people in Canada and also people in the UK. And I find it very effective. I do Skype with people some people in the UK, and some people in California. So, and I like to talk on Skype without using the visual because I think it's like paying attention. If I'm talking and I'm watching somebody and they're watching me, if they need to use Skype in the visual part of it, that's fine. I mean. And I'm very open to whatever the person needs and is able to tolerate, but I think it's easier for me to listen without trying to pay attention to the visual aspects on Skype. I work with a couple and on Skype, and also their child here in New York. So it's a very good way of communicating when you're long distance, and if you trust the idea that it's talking that cures. That's what really helps. I know a blind analyst. He was the head of one of the leading psychoanalytic institutes in New York City, IPTAR, Bert Friedman, and he was blind, and he did wonderful therapy. He had a great practice, and he was a great leader at this IPTAR. So if you can't see somebody, you can still do great therapy because even your instincts, you tune in more about, you pick up things more, most likely if you can't see, because other faculties are developed that might not be as well developed if you could see. I mean, it's just a way of looking at it. But anyway, that's about telephone therapy. And I'm talking fast. I walked here to work. It's about 6:30. It's easy for me to walk to work. So I enjoy the wind. I don't enjoy the people getting smacked by it later on today. But it was somewhat exciting to walk across 14th Street. And not so exciting to see the homeless people, though. I rounded a corner, a guy was there, and he was asking me for a quarter or any change that I had. And I knew I didn't have any change. So I said, gee, no, I'm sorry. I told the truth. I didn't have any change, but I walked away from him, and then I turned back, and I got a buck out of my pocket, and I gave it to him. And I don't know how they survive out there, but so the next corner, I was walking past this lady. She had this big, huge shopping basket full of all her belongings. She just looked interesting. She looked interesting to me. She was short and had all this wonderful jewelry on her fingers and earrings and clothes piled on top of her shopping basket, and what else was in there? Everything but the kitchen sink, because that was everything she owned. So I walked past her. I didn't say anything. Then I kind of stopped a little bit, and she said, oh, would you have any spare change? So I gave her $1, and I asked her, what are you doing with the weather conditions like this? And she said, well, there's a scaffolding that I live under during this weather, and she said, it's pretty warm there. I said, well, is it the kind of building that has the heat coming up from the vents? And he says, yes, it does. I lay down there, and it's not so bad. And I was thinking, it's really amazes me how people survive, because most homeless people do not want to be in a shelter. It's worse than being outside in a storm for them. So so I walked by her and I gave her $1, and I walked up to my usual bagel buffet place on 13th Street, and they were closed. They're a small operation, so I imagine it was hard for them to get into the city probably, and they love their bagels. So that was out. So I went up to this good stuff diner on 14th Street, right off 6th Avenue. So I got my bagel and cream cheese and coffee. So that was a pleasure for me. And food will quell all stress sometimes. And so as I was walking out of the good stuff diner, this big guy was he opened the door as I walked in, which many people do who are don't have work, or they might be homeless and they look for some spare change, and they'll open the door for them. I'm sure you've encountered that. On my way out, I said, he didn't ask me for anything. I said, do you need some change? And he says, oh no. He says, I do this to make people secure and safe, and they can come out and they see me here, and they know that's at least around the front area of Good Stuff Diner. You don't have to worry about people bothering you. And I said, oh, so you're an employee? And he says, yes. I says, oh, how long have you been working here? And he talked a little bit about himself, and he was a very friendly guy. So I was just funny that I was expecting that he wanted to change, because you don't have people opening the door as employees for you, except it gets on the Marriott Hotel or something like that. But this was a good stuff diner. And he says, oh, my name is Solomon. And I says, how do you do? My name is Mark. It's nice to meet you. And that was there was on my way back to the office. And Good Stuff Diner. I was going to meet a colleague at the diner. She was trying to figure out where we're going to go to have breakfast, because she was a teacher of mine and we haven't spoken in a while. So Mary Ann Jones, I really liked her a lot. I still do like her a lot. We haven't gone together, but because something happened personal in her family. But so I was giving her some options: a French roast, a Good Stuff Diner, and some other place. I don't remember whether. She says, well, you know what? She said, if a restaurant can call itself Good Stuff Diner, and they have that confidence in themselves, that's where I want to go. So that's the Good Stuff Diner. A little bit about what my usual routine is in the morning, and some thoughts about telephone therapy and bagels, and the inclement weather that I hope doesn't hit too hard. And the people that follow me on this channel, I hope it's okay, not too bad for you. I think I'm going to be all right in the midst of New York City here, but I know it can be pretty severe down in the Zone A, which is around the river, and especially in the cities and towns that are going to be affected, that are near the ocean. So that could be pretty tough. And it's going to be tough for the election too, in terms of that being disrupted. So anyway, this is Mark Sell, YouTube channel, Therapy for the Heart, and my heart's with you. And what does that mean, my heart's with you? I mean, I'm very happy to be here in the morning, because I like doing what I do. I'm a psychoanalyst, and I like making my YouTube videos. A lot of people respond to them, and that's very gratifying, because I usually respond back to them. They might have a question or a comment. So if you don't have a YouTube channel, you can open one up. If you need a Gmail account, and that's as easy as pie. You don't have to have any videos. You just open up the channel, and often you'll get all the videos about bagels and psychotherapy and psychoanalysis and hurricanes. Not so much hurricanes, hopefully, but you'll get immediately uploaded videos that I make here if you open up a channel. And if you like this channel and you don't open one up, that's fine for yourself. You can always put Mark Sell into YouTube and you'll find me here. And please like the video if you do like it, and subscribe to it, and if you can. And with that much ado, I'm going to sign off today. Thank you for listening. This is Mark Sell, channel Therapy for the Heart on YouTube. Right, bye-bye.